Penis size. What's normal? How do you even measure it accurately? And why does this topic cause so much stress for so many men? With the rise of male enhancement procedures and a constant stream of unrealistic images online, it's no wonder people are searching for answers. So let me start with something that might surprise you and maybe even give you a bit of relief. About 95% of men who worry about their size, they're completely within the medically normal range. Yes, you heard that right. The vast majority of guys who think there's a problem actually don't have one at all. The issue isn't physical, it's psychological. A distorted body image shaped by comparisons to adult films, airbrushed photos, and locker room rumors. It's fascinating, too, that this anxiety is way more common among men than women. Studies show that while over half of men, around 55%, say they felt insecure or dissatisfied about their penis size, only about 5 to 10% of women consider it a very important factor when choosing a partner. Let that sink in. So, take a deep breath. My goal here is simple: to inform you, to give you real scientific data, and most of all, to help you let go of anxiety that's probably doing more harm than good. I'll show you how to properly measure both length and girth. We'll talk about what science says is average, and we'll even explore some of the enhancement procedures you might have heard of, and whether they're actually safe. And I've got a wild little historical twist coming up that might just flip your perspective entirely. But first things first, how do you even measure penis size the right way? Because, let's face it, a lot of the stress around this topic comes from guys using the wrong techniques or comparing themselves in unfair ways. Alright, let's talk measurement, because this is where so many people go wrong. If you've ever tried to measure yourself and felt unsure, you're not alone. But once you know how scientists do it in actual medical studies, it all starts to make a lot more sense. There are two key things we measure: length and girth. Length is obvious. It's how long your penis is. Girth is the circumference, or how thick it is around. Both are important, and both can vary a lot from person to person. Now here's how to measure length the right way. You can do this when you're fully erect, or when you're flaccid but stretched out. And that stretched length actually gives a surprisingly accurate idea of your erect size. Ready? Step 1. Grab a ruler or a flexible measuring tape. Step 2. Press it against the top side of your penis, starting right at the pubic bone. That means you may need to press in a little to push past any fat pad there. Don't cheat yourself by starting at the skin. That adds extra length that isn't really there. Step 3. If you're measuring flaccid, gently stretch the penis out. Don't pull hard, just enough to make it straight, and measure to the tip of the glans. Same goes for when you're erect. Start from the pubic bone, go to the very tip, and keep the ruler flat on top. Easy. Now let's talk about girth, or circumference. This one's just as important and often even more misunderstood. For this, you'll need a soft measuring tape, like the kind used in sewing, or just a piece of string you can wrap around and then measure. Here's how to do it right. Wrap the tape around the middle of the shaft, not too close to the base, not near the tip, just the middle. Make sure it's snug but not tight. Then take the number where the tape meets. And yes, you can do this both when flaccid and when erect, but most medical data is based on erect girth. What a lot of guys don't realize is that one of the biggest sources of anxiety comes from bad measuring techniques or comparing apples to oranges, like looking at someone else fully erect and comparing that to yourself when you're not. That's not just unhelpful, it's guaranteed to make you feel worse for no reason. So now that you've got the right tools and methods, let's move on to the big question: what's actually normal? Because once you know where most people really fall, you might realize you've been stressing over absolutely nothing. Okay, now that we've got measurement down, let's dive into the numbers. What does science actually say about average penis size? Because once we strip away the myths, the Photoshop, and the adult movie illusions, the truth is pretty comforting. One of the most reliable sources we have is a massive meta-analysis. That's when scientists combine data from lots of studies all over the world to get one big solid picture. This one looked at nearly 15,000 men from different countries, ethnicities, and age groups. And here's what they found. When it comes to length, whether measured erect or flaccid and stretched, about 90 to 95% of men fall into the same range, between 10 and 16 centimeters. That's about 4 to 6.3 inches. The global average, 13.2 centimeters, or just over 5 inches erect. Yep, that's the real deal. Now let's talk girth, which again is the thickness or circumference. Flaccid, most guys measure between 8 and 10.5 centimeters, or around 3.1 to 4.1 inches. Erect, the range is 10 to 13 centimeters, which is about 3.9 to 5.1 inches. And the average erect girth, about 11.5 centimeters, or roughly 4.5 inches. So what does that mean? It means if you're anywhere in that range, length or girth, you're completely normal. You're part of the vast majority. Nothing is wrong. Nothing is lacking. You're literally textbook average. And here's something important. Even on the extreme ends, medical definitions are very specific. A micropenis is defined as being under 7.5 centimeters or about 3 inches in erect or stretched length. That's incredibly rare. And on the opposite end, a macropenis, which sounds like a superhero name, let's be honest, is defined as over 24 centimeters or 9.5 inches, also extremely rare. We're talking less than 1% of the population on either side. But the problem? Most men aren't comparing themselves to the average. They're comparing themselves to actors in very specific industries. Men who are often handpicked for their unusual size. And then what happens? Camera angles, lighting tricks, digital enhancements, it's all part of the illusion. And you end up judging yourself against a fantasy that isn't even real. So let me say this clearly. If you fall within those scientifically established ranges, you're normal. Full stop. And even if you fall outside of them, that doesn't define your health, your masculinity, or your worth. Period. But I want to take this a step further, because for a lot of men, the issue isn't just numbers. It's about confidence, performance, how you feel about your body. So let's talk about something that's quietly been helping thousands of men feel like themselves again, naturally. Now, before we move on to cosmetic procedures, I want to pause for just a moment, because if you're someone who's ever felt embarrassed about your performance or frustrated with changes in sensitivity, drive, or stamina, I want you to know something really important. It's not your fault, and you're absolutely not alone. Thousands of men across all ages have quietly struggled with the exact same concerns. It doesn't mean you're broken. It doesn't mean something's wrong with you. Sometimes it's stress, sometimes hormones, sometimes even lifestyle. But what matters is that there's hope. There's actually a 100% natural drug-free method that's been making a big difference for over 63,000 men. And the best part? It only takes about 7 seconds a day. Sounds wild, I know, but this isn't one of those gimmicks. No pills, no risky injections, no expensive gadgets, just a simple at-home technique that supports what scientists are now calling the manhood molecule, a powerful signal in the body that affects arousal, blood flow, and even staying power. If you're curious, you can either scan the QR code on the screen or just click the pinned comment below this video. It takes you to a short, no-pressure presentation that explains the science behind it and how you can try it at home starting today. All right? Ready to keep going? Because now we're stepping into the world of cosmetic procedures. You've probably heard about them online or in forums, things like fillers, injections, even surgery. But which ones are legit, which ones are risky, and which should be avoided at all costs? Let's get into it. Let's talk about a topic that's become more and more popular: penile enhancement procedures. I get it. With everything out there on the internet, it's easy to wonder, is there a safe way to improve size? The short answer? It's complicated. Let's start with girth enhancement, increasing thickness. The most common method used today is injecting hyaluronic acid, which is actually the same stuff used in lip and facial fillers. When it's injected along the shaft of the penis, it can temporarily increase girth by around 2 to 3 centimeters. The effect usually lasts between 12 and 18 months depending on your body. Sounds simple, right? But here's the thing, not all fillers are created equal. Some shady clinics use substances like industrial silicone or PMMA, which is not absorbed by the body. These can cause serious problems like painful lumps, inflammation, deformities, or even permanent damage. So if you're even considering something like this, please only consult board-certified urologists or plastic surgeons. Never go for a cheap option. The risks just aren't worth it. What about lengthening? Well, the truth is it's a lot more limited and a lot more risky. One option is liposuction of the pubic area. This doesn't make the penis longer, but it removes fat around the base, which can make it appear more exposed. It's more of a visual improvement than an actual length change. The second option is suspensory ligament release, a surgery that cuts the ligament holding the penis close to the pubic bone. It can give you 2 to 2.5 centimeters of added length when flaccid. But, and this is a big but, it doesn't affect erect length. It can even cause instability during intercourse. And as with any surgery, there are risks of infection, scarring, and complications that you really need to take seriously. One last thing, penile implants, sometimes seen online, are not for size enhancement. They're medical devices used to treat erectile dysfunction in very specific cases, usually when other treatments haven't worked. So, can size be changed? In some ways, yes, but the reality is that most procedures are either temporary, risky, or not as effective as people are led to believe. And here's the thing, you probably don't need them, not medically, not sexually, and certainly not to be desirable or masculine. And now, before we wrap this up, let me leave you with something I love sharing, a little piece of history that might totally change how you think about this subject. Back in ancient Greece, the ideal male body, yes, the one sculpted in marble and admired for centuries, was portrayed with a small penis. Why? Because it symbolized wisdom, discipline, and self-control. On the other hand, large penises were associated with barbarism, lack of restraint, and even comedic foolishness. Just look at the statues of gods and philosophers. You won't find anything exaggerated. But when you do see large penises in Greek art, they're usually attached to characters like Priapus, a fertility god who was literally meant to be ridiculous. What does that tell us? It tells us that ideas about masculinity, beauty, and even size, they're all cultural. They change over time. What seems ideal today might be something completely different tomorrow. And that means if you've ever felt ashamed, insecure, or pressured by what you see online or hear in the locker room, you're not broken, you're human. So if this video helped shift your mindset even a little, please give it a like, subscribe to the channel, and turn on notifications so you don't miss more real, science-based, judgment-free conversations like this. Your body doesn't define your worth. Your confidence does, your kindness, your health, your respect for yourself and for others. I'm Eva. Thank you for spending this time with me, and I'll see you in the next video.